Hello, I'm Richard Westerby from IV Fertility Services, and today we have Dr. Sara Mucowski from Dallas IVF. Hello. Today we're going to talk about egg freezing, which I know is something dear to you because
It's something that I have used myself to help prepare future me for the family that I may want at that point.
So diving right into the questions, is there an optimal age for a woman to freeze her eggs?
I think statistically, we would say for most women, the younger the better, because we have both a decline in the quality of our eggs as we age and the quantity of the eggs as we age. I use an analogy with my patients like a can of Coke. If I were to give you that can, all the bubbles it's ever going to have are in it when you get it. And once it's open, there's nothing you can do to make or save bubbles. So real fizzy is pretty much when we're born, and then flat would be menopause. So we want to capture those eggs, or essentially those bubbles, while we're in a fizzy state, so that we have our best chance of those eggs turning into a future healthy, successful pregnancy.
So you touched upon something quite interesting. You're saying that you have all of those bubbles at the beginning.
Correct.
What does that mean?
So that means that your eggs have been exposed to everything that you've put them through the course of your life, and even some of the things your mother's put them through, because all of your eggs from the start peak when you're in the womb and continue declining. That Coke just continues to get flatter with time as we age.
So you're born with all of your eggs.
Correct.
And they get less fizzy as time goes by.
You got it.
Wow. And what are some of the things that make them less fizzy?
So there's certainly lifestyle factors that can have an impact. Things that would be very obvious, like having had some sort of surgical procedure on the ovaries that would remove tissue and with it then eggs, right? Like taking a scoop of the Coke away from the glass. Certain things like chemotherapy, radiation can cause damage to the ovaries and thus the eggs as well. Other lifestyle factors like smoking we see has a negative impact. We know women who smoke go into menopause earlier than their non-smoking peers, so it's causing damage to the eggs there. And some people just are dealt a less fizzy Coke than their peers.
So you're not born with a specific amount of number. Every woman is different.
But it just, we know that with time, like I said, it becomes less and less.
And that could then mean that when you run out of eggs in menopause, that's different for everybody because their starting number was different.
I think it's just about how fast the Coke is kind of fizzing and getting flat, right? Think of maybe like one you'd get from a fountain soda, right? And how that's real fizzy and the lot of bubbles kind of popping that you can even see it sort of from the top, as opposed to maybe one you poured from a can, right? Just kind of how fizzy and how flat it gets.
Wow, that's a great analogy. I'd never thought about that. So optimal age, you've said, is?
For most women is going to be somewhere in kind of maybe mid-20s up to 30. As we know from a fertility perspective, women who are trying to conceive, that we see that kind of our peak fertility is going to be in that kind of mid-20s range. And so we can kind of capture, a good number of good quality eggs that we essentially, freeze now for the future, that they still retain that good quality at that point.
So when you freeze them, does that have any effect on the egg?
Not all eggs that we freeze are going to survive the thaw. So there's probably a component of were those just not great quality eggs from the get-go, right? So one egg does not equate one baby. So I don't know necessarily that it's the freezing process or if it's really just that wasn't going to be a good egg, even if we had tried to do IVF with it without freezing it at that point. So there's possibly, some component to that. But again, it's a numbers game. So the more we can freeze of the better quality, the better chance that we have ones that survive the thaw and ultimately become that healthy, successful.
So that leads me to a question of what is the optimal number of eggs to freeze?
So there's a lot of variety there. So the younger we are, we don't need as many. I would say we probably want somewhere in the 15-ish range per desired pregnancy. But there's
15 per desired pregnancy.
So it's quite the funnel effect. If we're older, we may need more because, again, the eggs that we're getting aren't as good quality. And so it may be substantially more depending on how big of a family you're considering in that future. So I think that just depends on sort of what we're looking at. And there's statistical prediction models that we can use based on age and the number of eggs frozen. And that gives us numbers on what is the statistical probability that this cohort of eggs results in at least one live birth, at least 2 live births, at least 3 live births. So that way we can figure out, again, growing your ideal family. Because even if you're not maybe using these eggs for baby number 1, right, you might want them for baby number 2 or 3 in the future.
That's a great point. So you could freeze your eggs, have a family, say naturally or through IVF or whatever it is, but use those eggs in the future for a subsequent
siblings. There you go. So I
think
think it's something, especially even in women who present to me maybe at 37 and they're now ready to grow their family with their partner, but they want a large family. They want 4 or 5 kids. It may make sense at that point that we're thinking of they may not need IVF per se to get pregnant for this baby number 1, but we might plan on doing IVF anyway to have embryos frozen for those future siblings as well. So same idea.
And I guess if you say you were 37 and you wanted to have a child, by the time you've tried to get pregnant, had that child, you're then maybe 38, 39.
Exactly.
And the egg quality is then declined.
Correct.
So it's almost like buying yourself that optionality for the future.
Correct.
Amazing. And by having eggs, does that guarantee that you're going to have embryos?
Unfortunately, there's no prediction on egg quality. And so there's nothing we can do to guarantee embryos, healthy pregnancy, implantation. But it just gives us that option that we may not have otherwise. A lot of people tend to think, well, if I need IVF, it's there when I do. But one of the biggest factors that's going to impact success of IVF is the eggs, the number that we get and the quality that we get. So if we're starting with younger ones, we have a higher chance of success than if, say, we were maybe starting with those 38-year-old eggs. If we can go back and use our 30-year-old eggs, we're going to have a much better chance of success.
Amazing. And could you maybe walk us through the egg freeze cycle?
Most patients will start with a birth control pill, not necessarily for contraceptive purposes, but kind of hormonally sort of have those eggs or what's housing those eggs, the follicles, sort of lined up at the gate. So that way when we remove the pills and typically start injections, which is an average of 10 days or so, real tiny needles, like an insulin syringe that you give yourself at home in the belly, just an average of 10 days. And then harvesting the eggs is a very minor day surgery. It's about 30 minutes. You're not going to remember anything. You're not going to feel anything. In most cases, you're still breathing on your own, so there aren't any breathing tubes. So it'd be more akin to, say, what someone might get out of a colonoscopy than major abdominal surgery. There's no incisions. How we access the eggs is through the vagina with an ultrasound. Once the ovaries are kind of full and heavy and those follicles are growing, they just kind of rest at the top of the vagina. So just a tiny needle that goes through the vaginal wall into the ovary. So we can access the follicles or the cysts that contain the egg with that needle and just kind of suction out that fluid so that under the microscope we can find and then ultimately freeze those eggs. So once we get started, it's a very short process. Like I said, less than 2 weeks from starting injections to harvesting the eggs. During that window, you may be seen every other day for quick visits, blood work, ultrasounds, so we can see how well the follicles are growing, whether or not we need to change the dose of medicines. And again, when we can anticipate harvesting those eggs so that people can plan ahead.
And do you instruct people on how to do the injections?
So we usually have videos,
Okay.
but we're certainly available in person as well for any questions.
Is the needle like this big?
Very tiny.
It's tiny.
So,
Where does it go?
So it goes in the belly. So if you
Okay.
numb your belly up with an ice cube first, you're probably not going to feel much of anything. That's always a plus. And then you just kind of take a little bit of skin and just inject that tiny needle. Most of them are pre-filled syringes or cartridges, very easy to self-administer. And then you think about diabetics who have to give themselves insulin multiple times a day. This is even easier than that in most cases. So definitely something where you can do it yourself.
So yeah, it's done at home. Does it hurt?
I would say no. I think eventually you get kind of, the first one's weird, right? Nobody wants to stab themselves. So once you get over that initial, I've personally felt that was really silly of me to like get so worked up over something so literally small, and then it just becomes easier from there.
And do you bruise?
Some people do. Some people swear by using things like arnica creams and stuff after to help minimize bruising. But, we're vascular beings. And so it's very possible in giving yourself an injection that you end up with a little bit of bleeding under the skin. And that's what we see as a bruise.
And from a physical perspective, somebody who's never done this before, what can they expect to feel?
I would say every person and every cycle really can be different. Some of the side effects that we see from the medications are more of what we see in response to the estrogen that the follicles that are growing make. So estrogen is responsible for things like breast tenderness, nausea, mood swings, bloating, headaches, things someone might experience during a normal month, but maybe on a grander scale. Because instead of having just one follicle in play making estrogen, right? Like I said, we're hoping between 10 and 20. So It's 10 to 20 times the amount of that wonderful hormone.
And then again, I've never had the feeling of having ovaries, but do you feel your ovaries and do they grow? Because of course you've got all those follicles that are then expanding because can a woman feel that? Or is it just like it just happens in the background?
I think some people are certainly more sensitive to it than others, right? We're a very contained space. And so as those follicles are growing, the ovaries may go from, say, walnut size to the size of an orange. So you may feel very full and uncomfortable. And maybe, during kind of the end of the process, you might notice certain clothes might be a little bit tighter or more uncomfortable. Gonads don't like to be squished, I'm sure. Regardless of your sex, you could attune to that. So they may notice some kind of twinging and discomfort. So we do recommend, especially as the ovaries are becoming enlarged, to kind of minimize physical activity. Nothing bouncy or increasing abdominal pressure, because the ligament that sort of holds the ovary in place gets kind of pulled on, right? The ovary is kind of heavy. And so we don't want to do anything where that ovary may flip on itself or undergo what's called ovarian torsion. It's a very rare risk, but it's a real risk. We tend to want to avoid activities where we kind of feel those twinges and pulls a little bit more to help minimize that risk of torsion.
And then completely changing tack. So to freeze eggs, do you need to have a partner?
Absolutely not. The eggs are yours and yours alone. What's great about freezing eggs is it has no impact on your future fertility in a negative fashion, right? So back to that Coke analogy, we're not pulling bubbles into play. We're just going to rescue those that would have otherwise died off that month. So we're capturing those that would have kind of just popped on their own and then saving them for the future.
That's really interesting. So you're not depleting from a future round.
Going away anyway. And like I said, we're going to rescue them and potentially give them a place for the future.
And I think you touched on it a little bit. Is there any long-term harm to somebody for taking those medications?
Not that we see. Everything seems to be pretty short-lived. Again, mostly just kind of the side effects from the extra estrogen that's around. We don't see any impact on new onset, breast or ovarian cancers. Not having children is actually a risk factor for those cancers. So some of the early studies looking at IVF didn't take that into account because we didn't know that yet. So newer studies that don't show any impact.
So ultimately, you would recommend anybody in the age range of around 30 to do an egg freeze?
Absolutely, especially depending on kind of what their overall life and family building goals are. For me, I knew that undergrad, med school, residency, fellowship were all going to take a significant chunk of time, largely the entirety of my, most fertile window of my 20s. And so it made the most sense for me to do it kind of sooner rather than later, because like I said, the younger, the better in a lot of ways when it comes to egg freezing. So there was no point for me to wait until I was in my mid 30s to do that, knowing that at 29, I still had a ways to go professionally before I would even be ready to consider growing my family. I think what a lot of women probably don't realize is that once those eggs are frozen, it takes a burden off your shoulders that you didn't even realize was there. So that gives you an immense amount of freedom.
Thank you very much.
You're welcome. Thanks for having me.